Managing mental illness and substance abuse problems requires a lot of teamwork, and that includes community partners. Intermountain Hospital RN Renee Gerhardt explains the steps taken to protect these partners and the patients they serve. So Renee, at this time, can hospitals, physicians, and other providers still reach out to Intermountain Hospital for those patient references and help?
Absolutely, and we still encourage them to do so. There isn't a lot of change in that practice, so they would still call our hospital, talk to one of the admission coordinators, and then we typically invite them in right away or within 24 hours to have them come in for a reassessment.
Tell us too, how has COVID-19 impacted those community partners that Intermountain works with? How has it impacted the relationship and the way that you guys work together?
I don't think that it may have much of a negative impact at all. Again, because of our current practices, we're screening folks before they come in to try to protect our staff and patients.
Renee, help us to understand what changes can community partners expect when they call to do that patient referral?
So when referral sources give us a call, they are immediately directed to one of my admission coordinators. They then fill the call, kind of find out the demographics of the patient, what's happening with the patient, and then typically we invite them in right away for an assessment. The assessments here are free, and then during that assessment we determine whether or not they meet criteria for inpatient admission if they need that level of service.
And are all Intermountain Hospital services still available, including inpatient and outpatient?
They are. All of our inpatient psychiatric services are still available, as well as our inpatient detox and recovery services, as well as our intensive outpatient and partial hospitalization programs are still available.
And I know too, when someone is being admitted into Intermountain Hospital, having support is really important. Are families still allowed to come with patients as they're being admitted? What does that look like?
We are asking currently that they limit that down to one person at the door, so that we can kind of just minimize the amount of people that are in the lobby at any given point in time.
But do tell me, how has the visiting protocol changed? Are they still allowed to have visiting hours?
Just by phone. We've eliminated for the time being person-to-person visits, again, just to help minimize the spread of the virus.
And then back to those healthcare professionals, how can they reach out to Intermountain Hospital for those patient references, referrals, and for help?
They can go to intermountainhospital.com, or they can call us directly at 208-377-8400.